The numbers are included in the most recent audit on Guam's only community hospital, highlighting weaknesses in its accounting practices, one of which is that the Guam Memorial Hospital still faces significant challenges in its ability to collect money it's owed. The report states that as of FY 2008, of the $152 million in accounts receivables, over $117 million is uncollectible. That means for every dollar in patient receivables, GMH expects to collect only 23 cents. GMH Chief Financial Officer Jane Flores says they've been beefing up their efforts to improve collections, including recent attempts to garnish tax refunds and rebates, but it's still not enough.
We did make significant increases in our collections last year, and that's because of the federal stimulus program. We were able to garnish some of the money from the Department of Revenue and Taxation, so that really helped us last year. We did begin the collection up front. That was something we were never doing before. We were basically waiting for people to be discharged, and then we would do collection calls. So we changed our tactics, and we tried to talk to people before they left the hospital and letting them know they do have a bill. How would they like to make payments? So that did render some payments at the hospital, but it didn't render enough.
In fact, Flores says of the $60 million referred to the Department of Revenue and Taxation, they've only been able to recover some $300,000. So what else can the hospital do?
I don't have a big stick to have everybody come in and make a pay like some of the agencies like GPA. They can cut off the power. Here, I can't cut off medical services. I'm mandated to provide that service regardless of their ability to pay.
Flores says they are now taking another step to at least allow patients a chance to pay their bills at a discounted price.
We have it till May 2nd. If you have a bill, we will give you a discount. Of course, you have to pay it in full. And after that, we're gonna assess how many remaining accounts we have outstanding, and then we're going to do another referral either to revenue tax or collection agencies.
In the meantime, Senator Frank Uggan Jr. has raised some concerns over the poor financial state of GMH and is calling on the governor to see to it that general fund allotments are released. Uggan, in a letter to the governor, says GMH has been operating in the red and is not able to meet its monthly obligations. He also points out only a quarter of its monthly allotment is being appropriated. In March, only $3 of the $12 million was transferred from the pharmaceutical fund. Uggan is looking to ensure that the hospital is given enough cash to at least meet its operational costs.
In terms of the pharmaceutical fund, general fund allocation and support to GMH, I'm urging the governor to intercede and to ensure that all of those revenues are remitted to GMH in a timely manner so that at least it would allow for GMH administrators to focus on providing quality health care and not necessarily be limited by restricted funds.